Hi, everyone. Welcome to Community Eligibility, a Proven Success, hosted by the Food Research and Action Center. I'm Erin Kennedy Heisem, Senior Child Nutrition Policy Analyst at FRAC. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation, and we will share the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show Captions in the bottom taskbar and select English as the spoken language. We'll have time for questions and answers at the end of the presentation. To ask a question at any time, please use the Q&A tab also in the bottom taskbar. With that, I'll pass it off to Shanella Palmer, Emerson National Health Fellow. Take it away, Shanella.
Thank you so much, Erin. Good afternoon, everyone. My name is Shanella, and I am the Emerson Fellow here at FRAC, working with the Child Nutrition Team on school meals, specifically the Community Eligibility Provision. Next slide, please. A little bit about FRAC. FRAC is a nonprofit organization that works to improve nutrition, health, and well-being of people affected by poverty-related hunger through technical assistance, policy advocacy, and research. Next slide, please. For today's agenda, we will be going over the background on the Community Eligibility Provision, commonly referred to as CEP. We will then hear about a student's perspective on the benefits of CEP from Armin Khan, a senior in high school from New York. Francesca DiGiorgio, School Meals Policy and Engagement Specialist of Hunger Solutions New York, will provide us with an advocate's perspective. After, we will hear from Stephanie Utley, the Director of Child Nutrition of LaRue County Schools in Kentucky, for a school nutrition operator perspective. And Juliana Cohen, a professor at the T.H. Chan School of Public Health, will discuss what the research is saying about CEP. Next slide, please. So CEP emerged from the Healthy Hunger-Free Kids Act of 2010 and was phased in during the 2011-2012 school year. In the 2014-2015 school year, CEP became available nationwide. Fast forward to 2023, the USDA ruled to lower ISP requirements from 40% to 25%, allowing more schools to be eligible for CEP. Next slide, please. To be eligible for CEP, individual schools, school districts, and/or group schools must have a minimum of 25% identified student percentage, which are students who qualify for free meals because their household is already enrolled in SNAP, TANF, FDPIR, and in some or most states, Medicaid. Schools who meet the eligibility criteria and decide to enroll must offer free breakfast and lunch for all students. Each cycle of CEP lasts 4 years, so schools that are still eligible after those 4 years may re-enroll. Schools that are ineligible may qualify for a grace year. It is important to note that right now we are in CEP season. Schools must inform their state agency by June 30th if they want to participate in CEP for the following school year. Next slide, please. So CEP uptake has been on a steady incline since the 2014-2015 school year, with a small drop in the 2021-2022 school year when all schools were offering all students school meals at no charge thanks to federal pandemic era waivers. We saw significant growth in CEP adoption following the end of those waivers in the 2022-2023 school year. Once schools experienced the benefits of healthy school meals for all, they did not want to go back to the traditional tiered reimbursement system of categorizing children as eligible for free, reduced priced, or paid meals. Many schools that were able to adopt CEP did. Increases in adoption were also driven by state policies that support CEP and healthy school meals for all, as well as implementing Medicaid direct certification. Last school year, 2023-2024, 1 out of every 2 schools that operated the National School Lunch Program used CEP to offer free school meals to all students. This really speaks to the benefits CEP has on children, schools, and the larger community. Next slide, please. Every year, FRAC collects and analyzes CEP participation data. Looking at last school year, we saw over 7,700 school districts and 47,000 schools implement community eligibility, reaching over 23.6 million children each school day. This was nearly a 20% increase in adoption compared to the 2022-2023 school year. We are currently analyzing CEP participation data for this school year and anticipate releasing our 2025 report within the next few months. Next slide, please. So there are so many benefits of CEP and offering free school meals to all students. Last school year, 60% of school offered all students meals at no charge, either through CEP or state's Healthy School Meals for All policies, and for good reasons. CEP reduces the need for school meal applications, reducing administrative burden on school food service departments. CEP provides free meals to all students, which reduces stigma around school meals. CEP also allows households to stretch their food budget because less of it goes towards food that is otherwise provided by schools. And CEP supports household food budgets, allowing for higher quality meals at families' dinner tables. CEP really improves food insecurity by ensuring all students have access to nutritious meals. But those aren't the only benefits. I will now turn it over to our panel of experts to share their take on the benefits of CEP. First up is Armin Khan.
Hello, everyone. I'm Armin Khan. I'm a senior at the Brooklyn Latin School in New York City. I currently am attending as a panelist as a student because I have been in the public school system for my entire life, and I've grown up on school food essentially. Just a bit more context about myself. Next slide, please. This is a bit more of an introduction about myself. I'm a youth food advocates intern that's interning under Community Food Advocates, a nonprofit in New York City. And we specifically as youth food advocate, we advocate for more inclusivity within school food and making school food more accessible to all people, regardless of their circumstances. I'm a senior at Brooklyn Latin. You could click the arrows, it'll continue on. Yeah, my future aspiration, surgery, more likely nutritional surgery. You can skip the slide if you want. Well, I'm a Queens native. I like reading and coffee as well. That's enough about me though. Within this 10 minutes that I have with you all, I kind of wanted to talk about how my experience with the universal school food has been. So for me in New York City, CFA advocated for universal from 2013 to 2017. And in 2017, when it passed, I was a fourth grader still. And I've been in elementary and middle school and high school in a public school system. So, and I've always been low income. So I've always been eligible for free or reduced lunch. So I've been reliant on school food my entire life, essentially. Next slide, please. Here, I have like a little bit of a timeline. There's pictures of me in elementary and middle school and high school. I included the pictures because I was gonna come into this meeting with clown makeup because I have a school carnival going on. But besides the point, in elementary school, you can see in the cafeteria line over there, I was mostly within the system where they would serve and offer which option they had for school food. And I specifically remember growing up, we would have these little index cards with barcodes, and it would have our name and our student OSIS number that we would have to scan to let the staff know that we are eligible for free or reduced lunch. And that was a consistent thing from kindergarten all the way up to fifth grade for me. And I think in fifth grade in 2017, when the Universal Lunch Act passed, that's when they stopped using those index cards. And recently I had a conversation with another individual who works at CFA and their experience with school food. And they had a similar ticketing system with being eligible for free reduced lunch. And I think one of the biggest things that came from being, isolated with these ticketing systems was the fact that you were known as a person who had free or reduced lunch. And it was a very big thing with like stigma and, because you were seen as like the free kid. And I think growing up, I had a lot of not very positive experiences with school food because I was eligible for it, but there are kids around me whose parents could pay for it and they didn't want school food. And it was like there was like this sense of isolation because I wasn't getting I was getting more help than them, but that felt like I wasn't deserving of it in a sense, if that makes sense to me. That was what was going through my head as a kid. Um, and then in middle school, during this time, I think Universal was fully enacted, and I had the, I guess, opportunity to experience it with no ticketing system, and everyone was just eligible. Although I still had to use the ID to swipe in to let them know that I have my lunch period. Unfortunately, during my middle school time, I also had the pandemic occurring. And for me, school food is completely closed off, and I didn't really have access to school food. And I was more so reliant on home food or, finding ways to feed myself with my family. And specifically in New York City, they use the money that was supposed to go into school food for children into EBT cards and distribute them. And so that did help my family a lot. Another thing I do want to note is that in elementary school, I knew from the start that I was eligible for free reduced lunch because I would see my parents filling out the forms and I saw like how they would have to figure out how much money they were either going to input in or what other forms they had to do because they couldn't make the income bracket to say that, oh, we're paying full price for this. And I also remember I have an older brother and he was going in high school during this time and he had a similar process where it was a lot of just filling out forms and more forms to let them know that we are low income, we're not eligible, we need free reduced lunch in order to feed ourselves. And that process itself was very, I guess, it overexerts you a lot. For my parents, I know that they were like hardworking from the very start. And then also with this, trying to get more support for their old children to get fed during school was also another thing they had to work with even as an immigrant. I think moving forward though, with Universal being within the city of New York, it was very helpful because the forms were much more convenient and there wasn't much of like a need for extra forms to specify conditions or circumstances. And that was helpful for my parents because they had to worry about how they were going to feed me or feed my brother as I moved up in the grade. And those nutritional requirements change because I'm a developing teenager, and you know, the USDA and the FDA regulations also change, as well as the Office of Food and Nutrition regulations change for nutritional needs within the school meals. And then in high school, that's me in high school. That's my cafeteria. These are all my cafeterias except the first one. I couldn't find my elementary school cafeteria, but these are all public schools as well. I need to specify that. In high school, I took this picture actually of my cafeteria because it was recently remodeled to be an enhanced cafeteria. And we were given this opportunity because New York City the Office of Food and Nutrition wanted to make school food more accessible and more appealing because besides being free, they wanted children to actually eat it. And so a big part of that was remodeling the cafeterias and making it feel more new and more vibrant. And that really did help me and my peers that were also eating school food because even if it was free for me in middle school, not a lot of kids ate it because it just felt depressing and there was still this, I guess, lack of life within the cafeteria. And then elementary school, adding on to that lack of life in the cafeteria, there was also the stigma that was heavily implied when getting school food for me because they would see us lining up to get school food with those index cards. And I think with that, it's like it made me have sort of a negative outlook on school food because I knew it was there to supply me with nutrition, but at the same time, people were looking down at me and I didn't feel that appreciated within that space. But with universal passing, it's helped me understand that this is a right that everyone should have, regardless of their income bracket. and that food is something that should be accessible to all people, regardless of their economic circumstances or societal circumstances. And as I've gotten older as well, I've come to realize more of my parents' struggles with money and how it is very hard to navigate money living in a very populated city like New York, and trying to figure out how they can feed their children while also trying to pay bills. It's like a very convoluted mess, which I understood better now that I've gotten older. And I'm very grateful that Universal has passed, because now I don't need to worry them about paying for my food, because I know that I have access to it regardless of my circumstances. And it's just been, I guess, really relieving, because now I know this more than ever. But to give a bit more background, I know this because I am a youth food advocate intern, and I am heavily invested and educated within the realm of school food, especially within New York City. And so before I was an intern, I always had this misconception that there was no like price associated with school food. Like you were either eligible, full reduced, or you had to pay full. And when talking to other kids my age, I don't think they ever realized that you had to pay money for school food actually. And even now, because 2017 was when Universal passed, all those kids after 2017 are in middle school now. So every kid from elementary to middle school have never experienced like paying for school food or having that struggle, which I think is a really great thing. And right now, within my age group, I think only high schoolers have understood what paying for school food is, compared to not paying and it being accessible to all, which I think is a great thing to notice. I guess another positive impact of Universal is that I don't really have to worry about my like nutrition, because I know that the USDA, and specifically in New York City, the Office of Food and Nutrition, they're taking active action to change the nutritional requirements to make it more inclusive and to make it more adherent to the student populace. So while getting access to this free school food that is also not putting an economic strain on my family, I'm also able to like nu- nu- pardon me, I'm also able to nurture myself with that food. And I think that's a really great effect. And I think if Universal were not to pass, the circumstances my family would be in and I would be in would be vastly different, because having access to that food has made a big impact in my life, because like I've said, I've grown up on school food. School food is mostly the only thing I know within school. I've never had like the luxury of my parents packing me lunch because of working constraints or because of timing constraints, also because of distance. And I think like having equitable access to school food is a really great thing, because it doesn't create this discriminatory factor between any student, regardless of their economic subgroup or regardless of their identity, and it just makes it accessible to all. And it's helped me to understand more of my rights as a growing adult, while also understanding what school food does for me living in New York City and as a student, and the rights that I have. Next slide. Yeah, thank you for listening. I think those are my 10 minutes, but if I have more, I can speak if warranted. But yeah, I'll leave that up to you guys.
Awesome. Thank you so much, Armin. It was very interesting to hear you talk about the ticketing system and
Mhm.
how access to school meals have impacted you as a student and as an individual. And so now we're going to hear from Francesca DiGiorgio of Hunger Solutions New York.
Hi, everyone. Francesca here with Hunger Solutions New York. Thanks so much, Armin. I really appreciated hearing what you had to share. And thanks also to the FRAC team for inviting me to share about the work we're doing in New York to assess the impacts of expanded community eligibility in our state. Next slide, please. First, just a quick overview of who we are at Hunger Solutions New York. We're a statewide anti-hunger organization focused on maximizing the federally funded nutrition programs. Our team works on all of the programs listed here on the slide to increase participation through statewide outreach and individual technical assistance. We're also advocates for policies to expand the reach of this programming. And over the last 3 years, we've been co-leading the Healthy School Meals for All New York Kids Coalition alongside community food advocates. And our coalition consists of over 350 organizations coming together in support of universal free school meals in New York. And as some of you likely saw in the news, and as Armin alluded to earlier, New York's final state budget did include full funding for universal meals starting in the upcoming 25-26 school year. We are thrilled about this historic win for New York's families and schools, and also for the opportunity to continue documenting the importance of community eligibility. Next slide. So to start, I want to provide some background on the school meals landscape here in New York and how this led up to our assessment of CEP. Next slide, please. Over the years, New York's taken several incremental steps towards universal free school meals by expanding access to community eligibility. CEP has been around here in New York since the 2012-13 school year, and for over a decade, we've seen the transformative impact on our state's highest poverty schools and piloted what's possible under a universal meals model. Our fiscal year 24 state budget partially expanded community eligibility by creating what's called the CEP state subsidy. And this subsidy ensures all CEP meals are reimbursed at the free rate, which makes it easier and more financially feasible for eligible New York schools to provide free meals to all. The rollout of the CEP state subsidy began last school year, 23-24, and correlated with the federal rule change mentioned earlier that lowered the CEP eligibility threshold to 25%. And during this period, we saw incredible uptake of CEP, with more schools than ever coming onto the program here in New York. In last year's state budget, we saw the CEP state subsidy funding sustained for the 24-25 school year and an additional allocation of funds since more schools adopted than initially anticipated. And during this year's budget cycle, we continued that push for statewide universal meals and ultimately saw full funding for the program included in the final budget passed earlier this month. So the official legislation enacting statewide universal meals will take effect in the upcoming 25-26 school year. Next slide. These historic state investments to expand CEP, coupled with the dramatic uptake by schools over the last 2 years, were instrumental to our campaign's success. And thanks to an incredible effort by our state education department supporting implementation, New York's now among the states leading the nation in growth of districts and schools adopting CEP. And this translates to 90% of New York students being able to receive free school meals as of the current school year. Next slide, please. So as a statewide organization, we're not a direct service provider, but our vision is to center more lived experience in our outreach to illustrate the value of the federal programs. And we saw New York CEP expansion as an opportunity to more intentionally uplift the voices of impacted New Yorkers in our campaign. In creating a statewide assessment, our goal was to understand the impact of New York CEP expansion by documenting the experiences of New York schools and families, both with and without free meals for all. Next slide, please. So we identified 2 groups to provide perspectives on the expansion for this assessment, including New York parents and caregivers, as well as New York school professionals, who we defined as school leaders, educators, and food service personnel. And as you previously heard from Armin, student voices are such a critical piece of this puzzle, but since our background at Hunger Solutions New York and existing connections were stronger with school systems and parents, we held off on adding students to this assessment. Next slide, please. And next slide, please. So we decided to split the assessment into 2 separate surveys, one for parents and the other for school professionals. Today, I'm just going to focus mostly on the results from the parent survey, since you'll be hearing from Stephanie later on for the school perspective. Next slide, please. We used a combination of strategies to promote the surveys while they're open this fall from October to December 2024, including social media, email blasts, in-person tabling at statewide conferences, and targeted outreach to existing partner networks, such as the New York State PTA and the School Nutrition Association, which was by far our most effective strategy, since these groups could really serve as our trusted messengers to promote the surveys. Next slide, please. So results. The findings I'm going to share will likely not come as a surprise to many of you, but they do underscore the robust body of existing research on the value of school meals and CEP. I'm sure we'll be hearing more about that from Juliana Cohen later today. So the power in these results is that they represent New York voices, which was important for our advocacy and continued work on buy-in with school districts for CEP. Next slide, please. Overall, we surveyed 420 parents and 220 school professionals, and we found widespread support among both parents and schools for CEP, as well as evidence of the provision's far-reaching benefits. Next slide, please. So parent survey results underscored financial relief as a key benefit for families and schools with free meals for all. On the right are some powerful parent quotes that we highlighted during our testimony for this year's state budget hearings, which focused on navigating food access amidst rising costs of living. Next slide, please. Beyond cost savings, the majority of families in CEP schools also reported time savings and reduced stress afforded by having access to free school meals. We all know that morning scramble many households face to get ready for school each day. And as this parent shares through their quote at the bottom center, not having school meals on the mental to-do list is priceless. Next slide, please. Firsthand reports from surveyed schools and parents also confirm what other studies, including national reports from FRAC, have found. When school meals are free to all, more students participate. And in these cafeterias, students are eating some of the healthiest meals available without fear of stigma. And the majority of parents in CEP schools reported that their child is not embarrassed to eat at school since meals are available free to all. Next slide, please. So some powerful reflections to share here on stigma from both parent and school perspectives that align with what Armin shared earlier today. Some parents with children in CEP schools noted the contrast to their own experiences navigating the free or reduced price system, which we see illustrated by the quote top left. And on the other hand, schools without free meals for all reported the persistence of stigma, with students paying the heaviest price, as illustrated by this quote on the bottom right. Next slide, please. Survey findings also make it clear that in schools without free meals for all, families are falling through the cracks. Among parents whose children aren't receiving free school meals, more than half reported financial stress related to paying for meals. We also found that 44% of these parents don't qualify for free school meals despite struggling to make ends meet, and that a third have a child with unpaid meal debt currently or in the past. Next slide, please. So I'm going to share some ways that we've disseminated the results at the state and federal level. Next slide, please. At the state level, we focused on tailoring the framing of findings to get healthy school meals for all done here in New York. The focus there was on affordability to resonate with our governor's agenda. We integrated findings from both surveys throughout our campaign materials. And in March 2025, we launched our official assessment webpage, which was then disseminated through emails to our networks, the legislature, and the governor's office. Next slide, please. For federal advocacy, we're shifting our focus to communicate the value of CEP and protecting the program from federal cuts, using this assessment to frame CEP as a critical tool to make school meal programs more efficient. And to carry this message, we developed the one-pager here on the right. We recently distributed these as leave-behinds for legislative offices during our visits to Capitol Hill as part of FRAC's Anti-Hunger Advocacy Day, and we can pop a link in the chat for you. Next slide, please. Alongside our ongoing work to protect CEP, our wish list for next steps is to triangulate the assessment findings from this year with school meal participation data for 24-25, which will be available hopefully over the summer. The passage of Healthy School Meals for All in New York also opens up exciting possibilities for program evaluation. And while we're still figuring out exactly what's next, this first assessment gave us a strong foundation to build on. Next slide, please. And to wrap things up, I'll just share some lessons that I've been noodling on. First, interim assessments can serve as powerful building blocks to move priorities forward. So for example, we didn't have full school meal participation data for this year, but decided to seize the moment around the CEP expansion anyways. I'd also recommend you leverage existing partner networks to maximize your reach. Our strong response from surveys resulted from partners who were bought into this work and motivated to spread the word. And lastly, when it comes to developing your own assessment, you don't need to reinvent the wheel. Previous studies in states leveraging CEP and Healthy School Meals for All can help inform methodology and certainly pave the way for New York. Next slide, please. Shout out here to the studies from Massachusetts, Maine, Arizona, Vermont, and California, several of which were led by Dr. Juliana Cohen, who you'll be hearing from later today. Next slide, please. And if you have any questions or comments after today, I've listed my contact information here, and you can also scan the QR code to read our full assessment findings. And in the meantime, we can also pop that link in chat. And that just about wraps it up for me. Thanks, FRAC, and everyone on the call for your time.
Awesome. Thank you so much, Francesca. The assessment was really informative, and it really highlights how CEP, or the lack thereof, have far-reaching effects. So we really appreciate hearing from you. And next up will be Juliana Cohen of the T.H. Chan School. Sorry, it will be Stephanie Utley. My apologies.
It's okay. I can be Julianne if you want. Good afternoon, everyone. My name is Stephanie Atley. I'm the Director of Child Nutrition in a small district in Central Kentucky. We have about 2,400 students. I'm going to talk on the perspective of the impact on operations it has and continues to have here in our district. We have been full CP since, well, we qualified in April 2015, so the 2015-2016 school year. Our current ISP is 54.16%, which means after the multiplier, we receive about 86% of our meals at the free rate. Next slide, please. I think at this point, everyone knows that participation has greatly increased when you have free meals for all. It often leads to higher breakfast and lunch participation. I mean, like Armin said earlier, you know, when all students can eat for free, stigma is greatly reduced and accessibility is improved. Every student eats. It's part of the school day. And it also streamlines enrollment. When you have applications, the part of possibly messing that up and taking away from other things is just a big burden for staff. Without those, it increases program access. I included at the bottom of this our current participation data. District-wide breakfast is 63%, which if I didn't include my high school in that, I think most of you guys can attest to it would be much higher. My district-wide lunch percentage is 81%, which we're very proud of both of those numbers. We work hard. I have fantastic staff. Next slide, please. Labor, CEP, the impact on labor. I think I touched on this just a little bit. Thank you for my participation numbers. We work really hard on that. The administrative burden. At the beginning of every school year, if we were not CEP, we would send out applications and have to go through every one, which is that is submitted to see if the child qualifies for free and reduced meal applications, which takes a lot of staff time. And you can reallocate that labor to focus on meal prep service rather than paperwork. I don't want my managers in their office. I want them to be out with the students, with their staff, preparing meals that the students love and will eat. Staffing needs. Increased participation does require more kitchen staff, and it handles higher volumes, which I see as a pro, because with more meals, your revenue is also greater. And so you can afford to hire more kitchen staff with the higher meal volumes. My current situation down there with my staffing, I have 22 full-time employees, 2 part-time. One of them is my assistant who's part-time. She's a retired manager of 30 years. And the other part-time employee I have was my student worker last year, and she's in college. And so she works with us a couple days a week when she's not in school. And we also work with our special ed director to find student workers whose disability might not be. All of my student workers have come through our special ed workflow, and they're fantastic students. And the student worker I have right now too actually is going to work over the summer with us, and she's going to come back part-time while she's in school as well. Next slide, please. Meal quality, the effect of CEP on meal quality. With consistent federal reimbursement based on your ISP, you can much more easily project what your income is going to be. So you can forecast a lot easier because students are going to eat, you know what your revenue is going to be, and you can invest money in better and local ingredients too, which is a huge thing around here because we're pretty rural. And you can vary the menus, and you have that stability of knowing that your reimbursement, you don't have to collect, you know, paid rates and debt and all of that. So that is a huge one for our district. Again, with menu planning flexibility, more predictable participation, it just allows you to plan. Like, my revenue has gone up with reimbursement rates going up, but my participation is pretty steady across the last several years. And I attribute that to my staff. I will take no credit on that. And also, it allows you to focus more on nutrition. nutrition education, healthier meals. We go during National School Lunch Week and Breakfast Week. We invest in those events, and we go to classrooms and talk to them about what they want. And I have a committee at my high school that I meet with called the Snack Committee, School Nutrition Advocacy Council. I'm not sure what they name themselves, but I meet with them, and all this frees up time. I don't have to focus on calling parents and telling them to, give me money because their student owes money. Next slide, please. Alternative breakfast models. I know there's a huge push for this nationwide, and we have been doing many alternative breakfast models for many years. The CEP supports that because when you have stuff like breakfast in the classroom, grab and go, second chance breakfast real quick, I'll go over what those are if people aren't familiar. Breakfast in the classroom, we just started at our middle school this year. We've had it at our elementary schools for 12 years. A student is sent down by the teacher, gets a bag that has their breakfast in it, their milk, their juice, their hot item, their cold item. They eat, they mark it off on a roster, bring it back. My staff bring it up. Grab and go is just things that are morally geared towards older students. They just wanted to take it and go. And second chance breakfast is after first period for us. Our high school, I would say 90% of our high school students eat after first period when we offer it to them on the second floor of our high school, on the first floor, and then also in the cafeteria. It gives them a little chance. They're rolling in late, and CEP allows us to do that because we're not collecting money in the hallway. They put their POS ID in and we move on. Again, like Armin said earlier, reduced stigma. I know we talk about that a lot, and it was really helpful to hear it from her because we grew up in an era where meals weren't free. And we had to apply for all that. And they are singled out if they're not. So when you have CEP, this is everyone eats. It should be part of the school day. It is. Alternative breakfast models also increase breakfast participation, especially in secondary schools, which I said earlier, we started breakfast in the classroom in our middle school, mainly because the way our middle school is laid out is not very accessible to students coming to school to come to the cafeteria to get breakfast. And the staff there have been super supportive of it. And our participation there has gone from about 30% to 65% this year. And it's because they're eating in their room, and it's great. I'm a big advocate for alternative breakfast models. Next slide, please. All right, final slide for me, I think, as far as operations standpoint. The reimbursement rates, I explained that a little bit earlier with my ISP. When you multiply the factor 1.6, which is the multiplier, you'll hear people talking about that number, which for us is 86%. If I serve 100 meals, 86 of those meals are given to me at the free rate. And the other 14% are at the paid rate. And certain schools below an ISP threshold may not be financially viable under CEP. And I hear people worried about this. And for me as an operator, I think a lot of it's neglected sometimes because people, if your participation is high and you focus really hard and put a lot of effort into that, you can absolutely survive under CEP under 50%. Without meal applications, districts must find other ways to collect socioeconomic data for Title I and other funding. In our district, we implemented 2 years ago putting the household income forms as part of our OLR, which is online registration. Students cannot basically register. I mean, we haven't had to hold it over their heads too often, but they cannot register and get Chromebooks and participate in many things if that form is not filled out. And so doing that has incredibly helped people filling that out, because that is a concern for people that know what that means. A lot of Title I funding is based on your free and reduced students. And since we don't have reduced as CEP participant, we have to find other ways to collect that data from families. I have no idea how long I've been talking, but I can talk all day. My contact information is right there. I am always willing to help and talk to anyone. CP is fantastic.
Thank you so much for your unique perspective, Stephanie. And next, we will hear from Juliana Cohen.
Wonderful. Thank you so much. And just want to first start by saying thank you all for being here today. Thank you so much for FRAC for organizing this. And I'm also just so incredibly grateful to Armin for sharing her personal experiences, Stephanie, your professional experiences, and then Francesca being able to share these really valuable data out of the state of New York. And so I'm really so grateful for this opportunity to share with you some of the research that we've been doing. And what I'll be sharing is a lot of the results from a systematic review that we conducted, which basically looks at every publication that's been done that has looked at the community eligibility provision across the United States, and then compiles all those results to be able to create kind of broader summaries in terms of what the research is really showing us around CEP. Next slide, please. And what we keep hearing over and over again, and this is what the research really bears out, is that CEP has a profound impact on school meal participation. And as Armin pointed out, in large part, it's because the issues around stigma being relieved, around those barriers around the school meal applications, which can be really complicated. It can be really stigmatizing for parents, are not always in the language spoken at home. And importantly, what we see when we look at the data with CP is that the whole school participates, including among those who are already eligible for free and reduced price meals previously, because so much of that stigma of feeling different or other has been alleviated when you're providing school meals as just a part of the school day. Next. Additionally, we see that CEP is associated with improved diet quality and food security among children as well. And I think one of the most important things to highlight here is that it's in part because of the Healthy Hunger-Free Kids Act, where we have this improvement in both the quality of school meals, where we have whole grains, a greater variety of vegetables, more whole fruits, lower sodium, etc. And with that, combined with that increase in access that we see with CEP, is leading to these improvements in children's diets. And increasingly, research consistently now finds that school meals are on average one of the healthiest sources of food and are healthier than meals on average that are packed from home. And additionally, when families are able to save those funds by no longer having to provide a child with food for breakfast or lunch, it also increases their purchasing power, further reducing food insecurity for their entire household. And we know that there's a lot of research that shows the impact that food insecurity has on mental health outcomes as well. And so by providing these opportunities for children to have this reliable source of food, it can improve the mental health outcomes in addition to those physical outcomes as well. Next slide, please. And also importantly, we think about school meals are part of the whole school day. And we really need to focus on a lot of those academic outcomes as well, because this is what many of those stakeholders that make these decisions around school meals are really focused on as well. And so when we look at things like enrollment and attendance, we see that children, one, are more likely to attend school when they know that they have a healthier meal available. And additionally, it may also reduce the incidence of illness in part through those healthier school meals, which improves attendance. We actually just conducted a study that we just submitted to a journal, which has found that the impact of these type of policies, like the one that New York just passed, when we compare it with states that have de-implemented free school meals, we see that when we provide free meals to all children, it improves chronic absenteeism, which is really important. It's a major issue that we're seeing right now across the United States. Next slide, please. And also importantly, when we have these healthier meals, there's really strong evidence that improves executive functioning. So this is some of the kind of higher level processes that we see in children that are so critical for success in school. Things like impulse control, disruptive behavior, working memory, things like this. And there's really strong evidence that when children have these healthier diets with the school meals, it's associated with improvements in cognitive functioning, as well as thinking about those higher test scores that we're also starting to see with our research as well. It also may be that this is because of those increases in attendance. When kids attend school, they also do better academically. So we really see as kind of this multi-pronged way in which CEP is benefiting children academically. Next slide, please. So one of the most important things to kind of focus on when we think about what is the role of the community eligibility provision, it is incredibly important when we think about the dietary needs of children, promoting their physical health, their mental growth, ensuring that they're participating and consistently have access, diet quality and food security, as well as thinking about these other outcomes like children's mental health, their school enrollment and attendance and academic performance. And also really important to think about how important it is to continue to support these healthy school meal standards. We're going to be having further improvements starting this coming year, where we're going to also be further reducing the amount of sugar in school meals. And so this is an opportunity to further think about ways that school meals can be integrated with these healthier meals and these improvement in access as well. The one last thing that I'll note is I think that one additional really important point that Stephanie brought up was around the issue of school meal debt. And one thing that we actually have just been learning recently in our research is not only does it impact families financially when we think about school meal debt, but in fact, what we're starting to hear is that families are less likely to even interact with the school in general. They're less likely to go to parent-teacher conferences, for example, when they have concerns about school meal debt. And this can impact their whole school experience for that child. And so CEP is something that is critically important when we think about kind of the whole child and the impact that it has on these children. Next slide, please. So I've left my email address with you, but I'd also like to highlight our research website as well, where we have a lot of our publications available. We also have surveys that we've used with students and parents and food service directors as well. That's freely available on our website as well. Thank you so much.
Thank you so much, Juliana Cohen. And now I will quickly review some of FRAC's CEP research and resources before we get to Q&A. As a reminder, please enter your questions in the Q&A function on the bottom of your screen. Next slide, please. Sorry. Can you go back to the other side? I'm so sorry. Thank you. FRAC has a variety of resources available on our website. Fact sheets, case studies, and the research that was mentioned at the top of the call are all available online. You can use the QR code to take you right there. Next slide, please. Specifically, I want to bring your attention to our CEP database. This online tool allows you to search for schools or districts within your state to see who is CEP eligible and who is participating. The current database reflects CEP participation from the 2023-2024 school year, and the database will be updated with this school year's data once we publish the 2025 report. Next slide, please. And now we will open it up for Q&A. So I'm going to invite my colleague, Erin Heisem, to join us to help moderate questions. Thank you.
And thank you to all of our speakers. I love the variety of perspectives, all supporting community eligibility and healthy school meals for all. I'm actually going to invite all speakers to come back on camera. So we do have a few questions in the chat. For all of our attendees, if you have questions, you can drop them in the Q&A chat function on the bottom of your taskbar. We will get to them as time allows. So the first question, I'm going to direct it to Francesca, but then if anyone else wants to jump in, please do so. And I think it's a pretty valid question that many school districts are thinking about as more and more states adopt healthy school meals for all policies. So right now we're celebrating New York as the 9th state to adopt a healthy school meals for all policy. And the question is, what is the benefit of applying for CEP if your state already offers universal school meals? So why may a school district want to still participate in community eligibility if they are getting healthy school meals for all through state policy? I'll cue it over to Francesca, being that you're in New York, and then maybe Stephanie, I know you don't have healthy school meals for all, but you could still talk about some of those benefits.
Yeah, absolutely. Thank you so much for this question. I think simply put, CEP is not going anywhere here in New York. And I know it's certainly present in other states with universal free school meals. I can speak to here in New York, CEP is still the mechanism through which schools are going to be offering free school meals to all students if they meet that eligibility threshold of 25%. And so I think, like simply put, it's still very important to the fabric of how we've built our universal free school meals policy here, and the additional funding that's been added into the state budget will kind of make up the difference for the schools who aren't eligible through CEP. So a lot of our work over the coming year is going to be encouraging students to really maximize through direct certification and SNAP outreach to ensure that they're capturing as many of those low-income students as possible in their identified student percentage, so that they can really still be able to operate CEP and draw down the most federal reimbursements. So yeah, I think that's like the best way I can put it.
Thank you. Juliana?
I'll just add, so exactly what Francesca's saying. So this really maximizes the federal reimbursement that states are getting, which enables the states to be able to afford universal free school meals. We only have so much that states can be able to invest in a free school meal policy. And I know if you've been kind of watching the news, some of the states have had challenges even predicting that because participation's been so high, which is wonderful. But that means that sometimes the budget for the state has actually gone slightly over what they originally anticipated. So we were seeing that in the news with Colorado, for example, and they're not the only state. So it really helps to make sure that the state is maximizing the amount of reimbursement they're getting from the federal government. But also it enables students to be able to access other things like Sunbucks, which is what we call like the summer, it's like a summer EBT program that's relatively new as well. So all students that are enrolled or if they complete a free or reduced price meal application, they also have access to it, but that alleviates some of that burden as well, where now all the children within that CEP school can have access to that as well.
I think the key here is that when a state adopts healthy school meals for all policy, it builds off the federal program. Schools are still operating the National School Lunch Program and the School Breakfast Program, and then they're getting additional subsidies from the state. So Stephanie went into details about all the benefits from an operational side as to why you would do CEP. So if you're in one of the 9 states with healthy school meals for all policies and you drop CEP and you go back to a traditional system, it's going to increase all of those burdens on the operator that Stephanie mentioned, right? So you're going to have to start processing meal benefit applications. You're going to have to start verifying meal benefit applications. It's going to increase that paperwork burden, whereas CEP, as Stephanie mentioned, streamlined the operations and administration of the program, which allowed for innovative breakfast models, and allowed for more local food purchasing and investment and attention to meal quality. So the federal regulations and the administrative red tape that's associated with operating National School Lunch Program in the traditional manner would all return if you drop CEP, even though you were in a healthy school meals for all state. So from the student's perspective, it might look the same. All students are going to get offered a school meal at no charge. But from the operator's perspective, it's going to become a lot more challenging to run a traditional school lunch program than it is a CEP school lunch program. Would you say that's accurate, Stephanie?
Yes, absolutely. I mentioned, I think a little bit, it's a federal program. It's not a state-based program, so you know what you're going to get ahead of time. And like Francesca said, state funding can go away, and that can go away very quickly. CEP is hopefully here forever.
I also just want to call out in the chat, I just posted the memo that our state agency, the Department of Education, who administers the school meal program and stood up our subsidy and is leading implementation and technical assistance for the universal program. They just released guidance last week on how the program is going to work, and it specifically calls out the requirement for school to be maximizing federal reimbursements by operating community eligibility.
Yeah. Armin, I have to just take a moment and say thank you so much for your insights and your perspective and taking time out of your day to share that with us. We are advocates at FRAC. We have researchers on the call. We have school nutrition operators on the call. How would you recommend adults, advocates, and researchers and school nutrition departments engage students in school meals? Like, what are some tips or tricks or tactics that we can all use to better incorporate student voice and perspective in operating these programs?
First off, I want to say everyone did a great job. It was really nice to hear about your research. A bit sad that my story is kind of common for everyone with the data and like the correlation it has. I think in terms of the question you're asking, for me, I think the subject of school food itself, there is still a lot of stigma and a lot of misconceptions about it because it's perceived as being not healthy or not nutritious enough, or it's not appealing to the students or the population within that specific area, or like not inclusive enough. And I think a big part of that is mainly educating the students about what they're consuming and what they're putting into their bodies. One of the best ways to do that would be in health class, because for me in my health class, we really did not go in depth about the school food and exactly what can be consumed from what the actual school is providing to the students. I also think just educating in general, besides like class spaces, like taking the time as a school to be more engaged and like including leaders in the school community, like the parent teacher association or like the principal, and allowing them to make more, I guess, have a more involved approach to school food and letting students also have a say about what they prefer and letting them know that these are options available to you and what you are eating is considered nutritious and healthy, and they're abiding by these regulations by many different health requirements. Besides that, I think if, well, for me, I really didn't know about school food before I joined Youth Food Advocates. And I think having an external internship available to students that are more interested in learning about school food and the processes would be very, I guess, would bring a lot of exposure, because besides being exposed to school food, I've been exposed to like the procurement processes as well as like the Good Food Purchasing Act, which helps with finding more sustainable approaches to bringing more local items into school food and still having it fit those nutrition guidelines. I also think like having nutritional teams in schools and just in general more engagement and communication between the student populace and the principal and the cafeteria staff would be like the biggest step forward. Just to like preface this, I don't think like based off of my perception as an advocate and like being a senior in high school and talking to many different kids in different ages, I don't think they really know what school food has or what it offers nutritionally, but also like even if they're getting it for free, like they don't really question these things because it's just given in school. So we don't really know the process about how they're getting these items to us, if there's, money involved, if it's free, unless their parents have done research and told them that. So I think making that known is like the biggest thing, and then telling them you can have more of a say in school food and your opinion matters is the next big step for them. And just I guess engagement from all different populations and groups that are involved in the process of school food and helping children get their nutrition in. Sorry if
Yeah, I
that.
think that's great. No, I think that's perfect. And it kind of echoes something I heard a few weeks ago when I was talking with another high school sophomore. She was a high school sophomore, and she said, we didn't even know we could go to the food service department. Like, we didn't even know we could put feedback. Anyone would be interested in our feedback. And so really kind of engaging them and letting them know that their voice is valuable and we need to hear it. So we're getting close to the end of the webinar, but there is another question in the chat. And it's related, Stephanie, to what you were mentioning in Kentucky and the use of our free and reduced price meal data. So besides the example from Kentucky, what are some other ways to gather needed socioeconomic data? And I think that's going to really depend on what you're using that data for and what that need is for. With regards to Title I and federal education funding, U.S. Department of Education, in collaboration with U.S. Department of Agriculture, has released a series of memos and guidance, as well as at FRAC. We have on our website a guide that talks about the intersection of CEP and Title I, and there are a variety of options that school districts can use to allocate Title I funding when you no longer have individual free and reduced price meal data. And then when you're talking about state compensatory education aid data, there are also a variety of different policies state by state that will allow school districts to use different data metrics. Some use direct certification numbers that we use in CEP to determine eligibility and reimbursement. Some use direct certification times the multiplier. Sometimes you can use census data, but does anyone else want to comment on the loss of individual meal application data and how that intersects with CEP or anything else that they've seen? Armin, did you have a comment on that?
Not related to the loss of data, but I just want to note that in New York City, we still have a form called the lunch form, but it's more so used as to gauge like the economic status of a child and see if they're eligible for waivers. But that name, like lunch form, is still associated, even though CEP is accessible in New York City. And I think like that might be like one of the biggest misconceptions that's present for forms. I don't know how it works in other states, but that's just what I've noticed in New York City specifically. So like rebranding.
I would
Sorry.
add, no, you're absolutely right. When I took over 10 years ago in this district, it was very much forcing like kindergarten introductions. I would go and talk to incoming kindergarten parents, and the principals at that time were like, you make sure you fill out the lunch form, even though lunch is free. And I was like, it is not a lunch form. It has nothing to do with lunch, nothing. And I think that educating, we have admin meetings, and I worked really hard, and now we call it the HIP form, which it is. It's a household income form. I mean, which is for other funding from other programs. And I think it's about education, because it used to be a lunch form, but it's not. It has those forms mean nothing to operators operating CEP anymore. So I'll
Okay.
just throw that in there.
Thank you. I know we are slightly over, and there's some comments about food waste and farm to school. And I know, Dr. Cohen, you have dropped in some info chats. I dropped in the link you mentioned also earlier into the chat. I know you've done a bunch of research on time to eat and the impacts of making sure students have adequate time. And as Stephanie mentioned, and as we've seen through Francesca's research and other research like Dr. Cohen's led, when schools are able to offer healthy school meals for all, whether it's through state policy or CEP, meal quality improves. Their ability to purchase local products increases. Their ability to train staff on culinary techniques and recipes increases because they have more time. And I believe, Dr. Cohen, you recently released a research brief that said schools that are offering universal free school meals actually have less processed foods in their school lunch program. So if we're really invested in increasing the meal quality, and as you already stated, school meals are so the healthiest sources of food for most children across the country. And if we want to continuously improve that, we need to increase access, reduce stigma, and make the administration easier. I'm going to toss it back to Shanella to close us out. Thank you, everyone.
All right, thank you, Erin. And I just want to thank all of the amazing panelists and all of you for joining us today. So please connect with FRAC, join our listserv, and follow us on social media. Have a great day, everyone.